Doctor, what about the ER? We know many of you have questions, so we're going to be chatting live on Facebook with the doctor. Let's go live to our Alicia Laventer with information we all need to know about. Alicia?
Thank you, Izzy. I'm here with Dr. Glenn Hardesty, ER doctor at Texas Health. And doctor, we were just talking a little bit ago about how much activity the ER is seeing right now. Sort of paint the picture for us, if you will, what sort of patients are coming in and what they're presenting
Well,
with.
we're seeing a higher than normal volume of patients, obviously, and a higher percentage of those with flu. But our emergency departments at Texas Health are open, and we're seeing patients as we would on any other day.
So when we say that 7 new deaths were reported in Dallas County tied to the flu, that's scary. The total number now being 18. But we talk a lot about underlying conditions, and I want to sort of explain to our viewers what that is, and we'll sort of go through them one by one. So how do underlying conditions play a factor when we're talking about the flu being potentially fatal?
Well, if you have an underlying condition, it makes the disease just a little more, it makes the disease or people a little more prevalent to get the complications of the disease. Such as if they have asthma and they have or a lung condition, they're more likely to have complications associated with lung. If they have diabetes, they're more likely to have a prolonged infection.
So basically what we're saying is if you have one of these conditions, the flu sort of exacerbates it, and perhaps that can lead into conditions reaching fatal levels or very dangerous levels.
They could exacerbate each other, but I've seen many patients with the flu with asthma and diabetes that have a normal course of the disease. The presence of that of a comorbidity or an additional diagnosis doesn't necessarily make the flu automatically more dangerous.
It's not a guarantee.
It's not a guarantee. There are a lot of patients that have diabetes and asthma. They get through the flu just fine.
But basically we're saying if you do have one of these conditions, you really want to pay very close attention to your symptoms and monitor them, and perhaps maybe go see the doctor sooner?
Yes, if you have certain things such as difficulty breathing, or you have altered mental status, or they're behaving differently, those are situations in which, yes, you definitely would seek medical care and probably more emergent care.
Okay, let's talk Tamiflu for a second now, because this is sort of coming into the conversation now. Explain what exactly Tamiflu is and what it works, if you can.
Well, Tamiflu is an antiviral. It doesn't work on bacteria. It only works on the flu virus, flu A and flu B. And it works by preventing it from replicating or releasing the virus into the body. So once it infects cells, it prevents it from being able to release new viruses into the body.
Okay, doctor, thank you so much for explaining this. We're going to continue this conversation on Facebook Live right now, so search the WFAA Facebook page. We're going to be taking questions from